Good evening. Welcome to Sleep Time. Really? We're back here again this afternoon to talk about sleep disorders and to try to pass on some information to you to help you understand whether you have a sleep disorder, might have a sleep disorder. Dr. LeBean is with me again. How you doing?
All right.
Like enjoying being here?
Yes.
It's kind of cool, huh?
Yeah.
This whole scene is really cool.
Yeah.
Anyway, so we have email addresses that you can email us if you're interested in maybe asking a question or comment during the week and you think of something, you can email us. Dr. LeBean's sister girl, you got to leave them up there long enough for them to get it. So it's LeBean Sleep Center at coxinternet.com, and then mine is newstarrising21@gmail.com. So this is a live show, so if you're interested in calling in, please do ask a question, make a comment, tell me my hair's messy. I don't care. Do something. Tonight, I got on the internet the other night to do some research on sleep disorders, and was very interested to find that they actually have quizzes on the internet to let you know whether you possibly have a sleep disorder. Now, some of them really stunk, but I found 4 that were really good. In fact, I took one of them. The railroaders actually have an internet site that has a really good sleep quiz on it. That when I took the quiz, it actually came up with 2 of my sleep disorders. I was impressed.
Yeah.
For a sleep quiz to be that accurate.
Yeah, they're pretty accurate.
Now you do a sleep quiz in I take one in your office every time I go in.
That's right, it's required. We do sleep quizzes every time the patient comes in for a checkup. We mainly use the Epworth Sleepiness Scale, and that's a pretty accurate quiz.
And that's part of this quiz that we're going to do tonight.
Yes, I saw the Epworth was in there.
And it was also part of the one that I took that gave me the 2 of my 4 sleep disorders.
Yes.
So it was pretty cool. Okay, so let's start with the quiz, and you can answer the questions as they come up. You don't have to think about these a whole lot. So the first 4 questions: do you snore loud enough to be heard in another room? Now, I have a neighbor that I can hear her snoring through the bedroom wall. That's serious, right?
Yeah.
Is that some loud snoring or what? I can hear her through the bedroom wall. She serenades me to sleep quite often. Okay, so the second question is, has someone ever seen you stop breathing when you were sleeping? Okay, and then the third one is, do you fall asleep while driving or at stop signals? Okay, so those are the first 3. Now on this test, if you answer yes to any one of these questions, it has a pop down where it has some more questions that they ask you. That and these questions, do you know which sleep disorder these questions are addressing? I bet most people do. It's sleep apnea. And so they have a pop down where you answer another 5 or 6 questions that have to do with sleep apnea. Then there's the second group of questions. And I'm going to share these with you because I didn't make 2 copies. Maybe I should. Did I put these? Okay.
That's the Epworth.
That's these here. Okay, this is the Epworth. This is the test that Dr. LeBean was saying that he gives in his office, and I take this every week. When you rate this according to 0 to 3 0 is there's no chance of it ever happening. And then 1, a slight chance that it's going to happen. 2, a moderate chance that it's going to happen. And then 3, it's going to happen.
And happening meaning dozing off.
Dozing off, sleeping. Yes. Yes. Thank you. I didn't think about saying that. Okay. So, if you are, let's see the questions again. If you're watching TV, is there a no chance you're going to fall asleep? Is there a slight chance you might fall asleep? A moderate chance you're going to fall asleep? Or it's going to happen? Okay. If you're sitting inactive in a public place, so you go to a movie, you're in a meeting, you're waiting for, I've actually fallen asleep standing in a line.
Yeah. I've had patients to fall asleep on their feet, believe it or not. Another common place is waiting for a doctor's appointment in the doctor's office.
Yes. Yes. I actually used to also fall asleep waiting for the bus at the bus stop. I would fall asleep on my feet. And
Yes.
the bus would pull up and they would have to blow the horn to wake me up to get on the bus.
Wow.
So if you're sitting quietly somewhere, even in public, is there a will it never happen? Is there a slight chance it might happen, moderate chance, or is it going to happen? For me, it's going to happen. The next question on there is sitting as a passenger in a car for an hour without a break. Are you going to fall asleep? Is there a slight chance, no chance, a great chance? For me, I can't ride without falling asleep. I just can't do it. Even on the bus, I fall asleep. Although some of these are getting a little bit better. I have watched a movie all the way through in the past couple of months.
That's good.
So some things have gotten better. Okay. Lying down to rest in the afternoon when circumstances permit. What's your chances? What's the chances of you falling asleep there? Is no chance? Is it? If I lie down, I'm pretty much going to fall asleep. I don't have to lie down to fall asleep. So, is no chance, 0, moderate, slight chance, 1, moderate chance, 2, great chance, 3. Then the last one on that one is sitting and talking to someone. I have friends who got very used to me falling asleep in the middle of a sentence. I mean, and they would have to wake me up for me to finish my thought, to finish what I was trying to say. Or playing a game and wake me up when it was my turn. Or wake me up when I've fallen asleep in the middle of my turn. So, sitting talking to somebody or playing a game or anything like that, is there no chance, 0, slight chance, 1, moderate chance, 2, a great chance is a 3. Okay, now, if on just these few questions, if you score greater than a 10, I think, right?
Yes.
If you score greater than a 10, there is a real good chance you may have a sleep disorder. And this is a pretty accurate measure of whether you have a sleep disorder or not. how many, I mean, do you know anybody who just, when you're talking to them, falls asleep? I mean, it's not a typical thing to happen. Or do you see people when you're on the bus? Have you ever stopped at a stoplight and looked into another car and saw somebody had fallen asleep? I mean, this is some pretty serious stuff. So if you scored more than a 10, that's a real good indication that you may have a sleep disorder. And you may want to talk to your primary care physician about referring you someplace for a sleep study. Okay. So please call in somebody. It ain't ringing. Somebody's got to make the phone ring. You got to call in to make the phone ring. Yeah, you do. You have anything on any of that so far?
Well, like you stated earlier, it's an excellent tool that we use, and we encourage, I personally as a sleep physician encourage all physicians to have this type of screening questionnaire in their offices for their patients, because like you stated earlier, if they score a 10 or above on that questionnaire, it's a very high chance they may have a very serious sleep disorder that's
right.
Not to mention that's treatable, because it's a very accurate assessment of one's daytime sleepiness. So, and it coincides with different sleep disorders. So there's of course more than one. So you would need to have an official, like she stated earlier, sleep evaluation, which may include an overnight sleep study at a sleep center to help in the investigation process of figuring out exactly what's causing the excessive daytime sleepiness symptom.
Yeah. There. The next part of this test, which I didn't take the time to type up or anything, but it talks about how much caffeine you actually drink during the day, and how caffeine, I can drink caffeine or not, and it doesn't affect whether I sleep or not, honestly. I drink Diet Coke. I don't drink a lot of coffee or tea, but I drink my Diet Coke. But I can go days without it, and that does not affect me. Or I can drink caffeine until I'm floating in it. And is that typical?
If excuse me, if the individual have a serious sleep disorder, then it gets to the point where the disease progresses to a certain point or stage where caffeine no longer works as far as helping keep the person awake. Yeah, in the beginning it may have, but then over time, caffeine kind of loses its effect because of the fact that most sleep disorders are very progressive in nature, so they'll tend to get worse over time.
We're at the halfway mark, so there's a reason why I said that. That was to cue my editor over there so she could do something that we needed to get done.
Okay.
So, okay. So it is real that I can drink all the caffeine in the world and it don't make a difference whatsoever.
Yes, that's usually when patients come in to see a sleep physician like myself, and that's one of the things they say is that the caffeine or any type of caffeinated beverage or any type of stimulant like an energy drink, those things are no longer working for them. And so that's when it's getting to the point where the sleep disorder is becoming so overwhelming that they seek medical attention.
See, I never drank a lot of coffee or anything, so it never was an issue for me. But that makes sense. Okay, now the last set of questions are the ones that actually get into more of the other sleep disorders and that. So the first one, and these you answer just a simple yes or no. Are you sleeping more than 7 hours a night? And are you still tired when you wake up? That generally is an indication that you're not getting good quality sleep. I averaged, before I met Dr. LeBean anyway, I averaged 2.5 hours sleep a night. And that was quite often broken up into 30 to 45 minute segments where I would fall asleep, sleep for maybe 30, 45 minutes, wake up, be up an hour or two, fall asleep again for 30, 45 minutes, and that was my pattern. And was always tired, always falling asleep. Go in whenever you want. The second question, do you need more than 30 minutes to fall asleep when you turn the lights out? Why is that significant?
Significant because typically a normal, what we call sleep latency, which is a medical term that means time to fall asleep once you get into the bed, is less than 30 minutes. And if it takes you more than 30 minutes to fall asleep, that's an indication that you definitely may have a sleep disorder.
Now, I tossed and turned. I couldn't stay still. Is that also part of that sleep latency and how long it takes to fall asleep? Is if you can actually get comfortable and cuddle down and be still?
Yes, there's a couple of sleep disorders that pop in my mind when you say that symptom. One of them is actually called restless legs syndrome, and that give off that symptom. And another one is, of course, insomnia.
Mm-hmm.
So both of those sleep disorders display that symptom.
Yeah. Okay. I love it. This is so much fun. Okay. The next question. Do you sleep less than 7 hours a night? And then the next one was back to what I was asking a few seconds ago. Was, do you have trouble getting comfortable when you want to sleep? I have a terrible time getting comfortable. And I also, well, it has, I wonder if I got those questions. Okay, and then the next questions. We have 7 minutes left. This is moving much too fast. Okay, the next set.
Oh.
Editor, next set. Here you go. Do you frequently have a hard time going back to sleep when you wake up during your sleep? I generally have to get on the computer and play on the computer for an hour to hour and a half before I can go back to sleep. That's pretty typical too, huh?
Yes. Again, that's in line with more of an insomnia diagnosis with that symptom.
Mm-hmm.
But it could be other, other sleep disorders too, like sleep apnea. And that's why, the most common thing people do will treat any type of sleep problem as if it's just insomnia.
Mm-hmm.
But in reality, it can be other sleep disorders such as sleep apnea as well as narcolepsy.
Right.
So, that's why a sleep evaluation in a sleep center is very important to obtain to make sure as far as what's going on and what's really causing the sleep problems.
Well, and because, too, each disorder is unique and has its own form of treatment.
Correct.
Are there sleep disorders that home remedies work for? Sure. Your jet lag and how do you say that word?
Circadian
rhythm disorders. You know, you can reset those by using home remedies. Sure, there are sleep disorders that home remedies work for. There's some that they ain't gonna work for no matter what you do. And I know with the sleepless leg and the periodic movement disorder, I told one of my doctors this one time, I thought he was going to die. But I said, if I could only have one medication, I'd throw them all out the window except for the medication for my restless leg. Because that disorder is so painful and so uncomfortable. And I get the sensation in my arms too, which I had a neurologist tell me was a little unusual.
Yeah,
Not
rare.
uncommon, but unusual. So I get the sensation in my arms too. And it is so painful that if I don't have my medication, all I do is sit and cry. So I told him, if I only have medicine for one, that's the one. Even the depression, throw it out. So, next question. We have 4 minutes. Let's just read them real quick. Does your bedmate complain about being kicked by you in your sleep? Do you walk in your sleep? Do you talk in your sleep? Does your bedmate complain of you moving during your sleep? Do you strike or hit your bedmate during... I punched one of my ex-husbands in the face one time. I did, I swear I did. He came up, what did I do? God, I don't know what you did, but you must have did something. Felt the need to punch you during the night. So that does happen. It's seriously, I mean, I'm sitting here laughing. My daughter informed me about more than 15 years ago when she was still a young teenager that she would not sleep in the same bed with me anymore because I kicked the snot out of her. So I haven't had the joy of sleeping with my daughter since she was about 14 years old. Now, if you're interested, there is an email address for this site, for this sleep study. Wrong one. thesleepcenter.com. Just throw them all up there until you hit the right one. No, come on. We only got 3 minutes.
Okay.
thesleepcenter.com.
This is all we got.
No, I pulled it up earlier. So I know it's in there because I pulled it up earlier. If you want to take this, no, girl, we're not doing credits yet. It is thesleepcenteraz.com. There it is. I told you it was there. This is thesleepcenteraz.com, where you can actually take this sleep study quiz. Then there's 3 others. Can you find those? Hurry. We only got 2 minutes. Okay. The Railroader's Guide to a Healthy Sleep. If you go to your, where you type in what you're looking for, type that in, and it'll take you to their site. They have a little thing for you to read, and then you can click on this little box that has a picture of the quiz. This is the one that actually, when I took it, came up with 2 of my 4 sleep disorders. So it's a really good one. The ClaytonSleep.com has a real good quiz, and TalkAboutSleep.com has a real good sleep quiz. All 4 of these quizzes are really in-depth, looking for sleep disorders over a range, a high range. So, no callers, so please look up my email or Dr. LeBean's email and email us questions, comments, concerns, thoughts, ideas. whatever you have. If you're too inappropriate, I'll just give you the raspberries and erase your little message. But have a good night. We'll see you in 2 weeks. Bring up the credits now.
Oh.
Bring up the credits now.
Yeah, wait, hold on.
We've got to have our underwriters
Yeah.
acknowledged.
Okay, wait.
Come on, hurry up. We got 32 seconds.
Okay, yeah. Fred.
Ah, yes.
Okay.
Thank you for watching.
Good night.
Our underwriters is the great Harvest Bread Company. Go by there and get some bread from Mr. JP and tell him you enjoyed the show. And thank you so much for AOC for their facilities. They're fantastic. Wonderful. Good night. Did you stop?
Yes.
Hot dog! Hot dog! We got it. We're getting it under control.
We weren't live, but y'all will be on a rerun.
What do you mean we weren't live?
Got a city council meeting.
Huh?
City council meeting. You have to plan this when the city council is not meeting.
I thought I did.
Something happened.
Yeah, something happened. So it didn't go out live again.
It's recorded and it'll be rerun.
Yeah. Okay. Do you want to hang around and take your copy home with you? Since I won't be seeing you for 3 months?
Okay.